Hi, in this video we are going to discuss the clinical importance of spinal cord. The spinal cord have lot of clinical importance. Here we are going to discuss two important clinical aspects of the spinal cord. The first one is the Brown-Sequard syndrome. It is the hemisection of the spinal cord. Before going to the features of the Brown-Sequard syndrome, we must know some important terms to understand the features of the Brown-Sequard syndrome. What is meant by upper motor neuron? It is the fibers of the corticospinal tract or pyramidal tract from its origin in the cerebral cortex to its termination in the anterior horn cells of the spinal cord. What is meant by lower motor neuron? It is the fibers of the corticospinal tract from its origin in the anterior horn cells of the spinal cord to its termination in the muscles as alpha motor neuron. What is meant by ipsilateral? It is same side, contralateral, opposite side. So let us discuss the features of Brown-Sequard syndrome presenting in a patient at three levels. Below the level of lesion, it is very important in anatomical aspects. Below the level of lesion, the patient will be having loss of pain and temperature and light touch on the contralateral side due to the important transaction of the lateral and anterior spinothalamic tract. And the patient will be having ipsilateral upper motor neuron paralysis due to the pyramidal tract damage. And the patient will be also having loss of all dorsal column sensations. Which are the dorsal column sensations? Vibration, position and deep touch on the ipsilateral side due to the damage of dorsal medial lemniscus. And at the level of lesion, the patient will be having ipsilateral lower motor neuron paralysis due to the injury of ventral nerve roots. And the patient also has ipsilateral anesthesia of the skin over the segment due to the injury to ventral nerve roots. Above the level of lesion, the patient having ipsilateral hyperesthesia due to the irritation of dorsal nerve roots. Then the second important clinical aspect, lumbar puncture. It is done to draw the cerebrospinal fluid from which space? Subarachnoid space. The needle is inserted between the L3 and L4. Most preferable is L4 and L5 spinal segments with patient's back is flexed either in sitting or in lying in bed in left lateral position. So let us have a quick recap on the important points discussed so far. First we discuss the internal structure of the spinal cord. The spinal cord have an inner grey matter and an outer white matter. The inner grey matter is divided into three parts, which are the posterior horn, lateral horn and an anterior horn. The white matter is divided into three regions or three columns, which are the posterior white column, lateral white column and anterior white column. These columns consisting of tracts, either ascending tracts or descending tracts. So we are going to have to recap on the blood supply of spinal cord. The blood supply of spinal cord means the spinal cord is supplied by three sets of arteries, which are the anterior spinal artery, posterior spinal artery and segmental or radicular arteries. How is the anterior spinal artery forming? It is formed by the spinal branches of the left and right vertebral arteries. How is the posterior spinal artery forming? It is formed by the vertebral or posterior inferior cerebellar arteries. Then the third one, the segmental or radicular arteries. How it is forming? It is formed by the spinal branches of the surrounding blood vessels. Which are the surrounding blood vessels? Vertebral, deep cervical, posterior inferior, posterior intercostal, sacral, lateral sacral and lumbar arteries. Then among the radicular arteries or segmental arteries, the artery of Adamkiewicz, it have greater importance. It is a branch of the left posterior intercostal arteries. It has some functional importance and clinical importance. If any injury to this blood vessel occurs, it will result in severe neurological deficits like urinary and fecal incontinence. And it is essential to know this artery's location and its anatomy and clinical importance to minimize the risk of ischemic spinal cord injury, especially during the thoraco-abdominal aortic surgery. Then we discuss the clinical importance of the spinal cord. Which are they? The first one is the Brown-Sequard syndrome. Among the features below the level of lesion have greater importance. Which are they? The loss of pain and temperature and light touch on the contralateral side due to the important transaction of the lateral and anterior spinal thoracic tract. Then the ipsilateral upper motor neuron paralysis by the pyramidal tract damage. Then the loss of dorsal column sensations. Which are the dorsal column sensations? The vibration, position and deep touch on which side? In the ipsilateral side due to the damage of the dorsal medial lemniscate. Then we discuss the lumbar puncture. It is done to draw CSF from which space? Subarachnoid space. The most preferable site is between the L4 and L5. Thank you.